Well, let's be clear, this is a terrible bill. It raises costs for American families. It guts health care, 17 million people across the country losing their health care coverage, prices going up for everyone else. This is a terrible bill, and we are united in being against this bill, and frankly, more Republicans should be against this bill because the American people are against this bill. Poll after poll, the more people learn about this bill, the more they dislike it, and it is fiscally irresponsible. Republicans who want to make it worse, they've all voted for this once in the House. They have the chance to decide what they're going to do going forward. This is a terrible bill, and it's going to hurt all of their districts and their communities. So hopefully there will be some Republicans who are willing to actually stand up for the American people and vote against this bill, but we know they all cave whenever it comes down to it and follow along with Donald Trump.
So you're not expecting these no's to stay no's, apparently, Congresswoman. I'm just wondering, and I know there's not a lot of conversation across the aisle, if any, right now, but are you reaching out to Republicans who are on the fence or prepared to vote no to join your coalition against this legislation?
We welcome any Republicans who are going to vote no. They should be voting no because the impacts of this are devastating long-term impacts to our communities. And in Republican districts, to thousands and thousands of people losing access to health care, losing access to basic nutrition support, making sure that we have healthy foods for our kids, energy costs going up, the list goes on, and just $4 trillion increase to the debt, that impacts our kids too. So Republicans say they're fiscally responsible. Absolutely not. In this case, if they want to do something different, they should stand up, vote no, and come to the table and actually work on a policy that will help move our country forward, invest in our future, invest in working families.
Well, Congresswoman, obviously it is your charge at the DCCC to be looking at the map. And if you look at it district by district and how the impact of this legislation may ultimately be felt in districts with seats currently held by Republicans, how many potential pickup opportunities do you see as a result?
Well, I think this bill, it really defines where Republicans are, and this bill and their vote on this bill is going to be a huge reason we take back the majority in the House of Representatives. The American people reject the bill, but in district after district, we have 35 districts where we're on offense across the country. In those 35 districts, people in these communities will lose health care, see health care costs go up, see energy costs go up, see food prices go up. Republicans promised they were going to lower costs on day one. It's the #1 issue for families across the country. They promised they were going to lower costs. That's a broken promise. This big, ugly bill is also a big, broken promise. So we're gonna hold them accountable for that across the country.
Is that potentially 35 seats then, Congresswoman? Do you think it could be that many?
We have 35 seats we're in play across the country. We're recruiting great candidates. Folks are going to actually stand up for their communities, who are going to really be voices for their communities, talk about the issues that matter, and who actually want to come to Washington, D.C. to govern for communities, not be a blindly loyal vote for Donald Trump.
You've mentioned the number of people who could potentially lose health coverage, and I think 17 million is the number that we've been hearing, Congresswoman, that you mentioned as well. There's a new survey from Tony Fabrizio's group, commissioned by One Nation, that found 2/3 of voters agree there is waste, fraud, and abuse in Medicaid. How do you message to them?
We know that families across the country depend on Medicaid. Our rural hospitals depend on Medicaid. Look across the board. This has nothing to do with strengthening Medicaid. What Republicans are trying to do is rip it apart. $1 trillion, rip it apart, rip apart the Affordable Care Act subsidies that are out there. 17 million people losing health care, but also rural hospitals closing across the country, nursing homes. All of these are things that are supported through Medicaid that are critically important to all of our communities. And healthcare costs will go up for everyone in the country because even if you have coverage, premiums are going to go up when more and more people are using the emergency room as their primary care. We know, we've
Okay.
seen before how damaging that is. They're walking us down that path again now, and the American people know that.
Congresswoman, I know you need to run back to the floor, so very quickly here. Elon Musk this week has threatened to fund primary challenges of Republicans who vote for this bill, but also has threatened to start a new Third America party. Does Elon Musk pose a potential gift for Democrats if he's going to fund challengers to Republicans, or potentially a risk if he actually wants to fund a third party?
Well, I think Elon Musk called this bill a disgusting abomination. That's an apt description. We all should be fighting to prevent this bill from moving forward, but making sure we have great representatives across the country. The American people are with us on this. We're on offense, and this vote is going to cost Republicans the majority in 2026.